So now we're going to be talking about all of the structures that are passing through the superior thoracic aperture. Now we're going to be talking about them in three groups, so it's easier for you to remember. Some of the structures are part of the sympathetic chain. So as we can see, we have a contribution from the cervical ganglia, and we have contribution from the thoracic ganglia, and we have the Ansa Subclavia. Then we talk about the cranial nerves, and the vagus nerve is basically the cranial nerve, which derives the rest of the two. So the right recurrent laryngeal nerve and the left recurrent laryngeal nerve. They are both derivatives of the vagus nerve. And then we have structures from the spinal nerves, which includes the cervical plexus and the brachial plexus. So let's start. Okay, so first let's talk about the sympathetic chain. And within the sympathetic chain, we're going to be talking about the cervical ganglia contribution of the nervous structures passing through the superior thoracic aperture. So here we have three ganglia, 1, 2, and 3. So this one here, this is the superior cervical ganglion, and it is at the level of C2 and C3 vertebrae. And the next one is this one, the middle cervical ganglion, and this is at the lower level of the C6 vertebrae. And here is the last one. This is actually a combination. The inferior cervical ganglia, which is over here, it fuses with the T1 ganglia and sometimes even the T2 ganglia to form the stellate ganglion. So from the cervical contribution, we have here the inferior cervical ganglion. Okay, so remember, the inferior cervical ganglion, what it does is it fuses with the T1 ganglion to form the stellate ganglion. So what are the levels again? The superior cervical ganglion is at the level of the C2 and C3 vertebrae. And the middle cervical ganglion is at the level of the C6 vertebrae. And the inferior cervical ganglion and the T1 ganglion that fuse to form the stellate ganglion is at the level of C7 vertebra and near the neck of the first rib. And this occurs behind the vertebral artery and in front of the ramus of the spinal nerve C8. As you can see over here, this contribution is from spinal nerve C8. If I erase these, you can see, zoom in a little bit. So this is the C8 spinal nerve. Here is the T1 spinal nerve. And this is forming the brachial plexus. Here we have C7, C6, and C5. This is the stellate ganglion. It's receiving contribution from the T1 ganglia right over here. If you can see closely, there is a small nervous contribution coming to the stellate ganglion here. There you have it. Now, what's important about these cervical ganglion, because you're probably thinking, we're talking about the superior aperture. Why are we discussing these cervical structures? Although these are ganglia of the cervical sympathetic chain, but the purpose of giving an overview of them is because each of these three ganglia give off a nerve that travels through the thoracic inlet to join the cardiac plexus, which we will soon study in the near future. So from the superior cervical ganglion, we receive the superior cervical cardiac nerve. Okay, and from the middle cervical ganglion, we receive the middle cervical cardiac nerve. And from the stellate ganglion, receive the inferior cervical cardiac nerve. So all three of these nerves, the superior cervical cardiac nerve, the middle cervical cardiac nerve, and the inferior cervical cardiac nerve, they all pass through the superior thoracic inlet and join the cardiac plexus. Okay, so a few more points about the cervical ganglia contribution. Here is a rough drawing of the cervical ganglia. So here we have the superior cervical ganglia, and here we have the middle cervical ganglia, and here is the stellate cervical ganglia. And this is the right side, and this is the left side. Okay, so what we're talking about right now is these 5 nerves, this one, and this one. All of these participate in the deep cardiac plexus. And this one participates in the superficial cardiac plexus. So these green lines over here, I don't want you to think of them as part of a structure, but you just need to know that in the deep cardiac plexus, we have the superior, the right superior, cervical cardiac nerve, plus both middle cervical cardiac nerves and both inferior cervical cardiac nerves. These all participate in the deep cardiac plexus, whereas only the left superior cervical nerve, cervical cardiac nerve, participates in the superficial cardiac plexus. Okay? This is what you needed to know, because these nerves are the ones that will be participating in the cardiac plexuses that we will be discussing in the mediastinum. So the middle cervical ganglion also provides sympathetic fibers to the trachea, the esophagus, the thyroid, and parathyroid glands. They also participate in sympathetic fibers to the trachea, esophagus, thyroid, and parathyroid glands. So it provides sympathetic fibers to these structures over here. Okay? So next we're going to be talking about the Ansa Subclavia, which is part of the sympathetic chain. So the Ansa Subclavia, it's basically the middle cervical ganglia provides an anterior cord and a posterior cord. Here we can see the middle cervical ganglion on the right side. So it gives off an anterior cord and it gives off a posterior cord, which you can see traversing down here. It's moving through the stellate ganglion and looping around. So the anterior cord, it travels down and then loops around the first part of the subclavian artery, right, just medial to the internal thoracic artery. So here is the internal thoracic artery. As it loops around, it turns into the posterior cord. The Ansa subclavia supplies the rami to the internal thoracic artery and typically also connects with the phrenic nerve and vagus nerve. Further details on the cervical ganglia is irrelevant to the thorax and will be discussed with the head and neck. Okay, so now let's talk about the thoracic ganglia contribution. As mentioned already, the inferior cervical ganglia and the T1 thoracic ganglia merge to form the stellate ganglia. Here is the stellate ganglion on the left side. So it consists of 2 ganglionated trunks on either side of the vertebral column. As you can see, here is one of the columns of the thoracic ganglia on the right side. Here is the other one. The stellate ganglia, remember, it contains T1, and sometimes T2 may also be part of the stellate ganglia. Otherwise, if not, then T2 is usually part of the sympathetic chain of the thoracic part of the sympathetic chain. So it consists of two ganglionated trunks on either side of the vertebral column inside the thoracic cavity. Their branches and the prevertebral ganglia and plexuses. So these would be providing the nerves to the pulmonary plexus and the esophageal plexus, and they would be contributing to the cardiac plexus, both the deep and the superficial. The ganglia are connected with their respective spinal nerves via, number one, the white rami communicans from the spinal nerve to the ganglion, and number two, the gray rami communicans from the ganglion to the spinal nerve. The first five, T1, T2, 3, 4, and 5 ganglia give fibers to the heart, the lungs, the aorta, and the esophagus. So these are supplying all of these structures. So we were talking about those structures that pass through the superior thoracic aperture. And these sympathetic chains, as mentioned already, starting from T1, they pass down into the thoracic cavity and supply these structures. Okay, so now we're going to be talking about the cranial nerves that are involved in these. First, we have to understand that the vagus nerve is the one that actually gives off the next two structures that we'll talk about. So the right and the left recurrent laryngeal nerve. So in our diagram, this over here is the left vagus nerve. And this over here is the right vagus nerve. So the vagus nerve is actually cranial nerve number 10. And it is called vagus because of its vague course. It arises from two ganglia, the superior and inferior vagus ganglia. So don't worry about these. Don't worry about where these ganglia are yet, because this will be discussed later in the head and neck. The right vagus nerve enters the thorax by crossing the first part of the subclavian artery. So remember, this is the Ansa Subclavia, and we discussed how the Ansa Subclavia loops around the subclavian artery in the first part of the subclavian artery. Just before this, we can see that the right vagus nerve is crossing the first part of the subclavian right over here. So I just drew that in just for your information. Then inclining medially behind the brachiocephalic vessels to reach the right side of the trachea. There we go. And the left vagus nerve also enters the thorax by passing between the left common carotid. So here is the left common carotid artery. And between the left subclavian artery. So as you can see, the left vagus nerve crosses between the two arteries. It also travels behind the left internal jugular vein and the brachiocephalic vessels. So as we're talking about the right recurrent laryngeal nerve, you can see from the right vagus nerve over here that there's a tiny branch. So let's zoom in for you a little bit. There's this small branch over here that is looping around the subclavian artery. So this tiny little branch over here, this is the right recurrent laryngeal nerve. And it arises from the vagus in front of the right subclavian artery, loops posteriorly behind the artery, and then runs supromedially behind the subclavian artery and common carotid arteries to reach the tracheo-esophageal groove. It gives contribution to the cardiac plexus and the trachea and the esophagus. Then we have the left recurrent laryngeal nerve. And the left recurrent laryngeal nerve, it takes a longer time for it to loop around and come back up. As it crosses the aorta at this point, that's where it comes out. And this nerve over here traveling up through here. This is the left recurrent laryngeal nerve. This is the right recurrent laryngeal nerve. You can see here. Traveling, looping around the subclavian artery. The left recurrent laryngeal nerve arises from the vagus in the thorax while it crosses the left side of the aorta, loops around the ligamentum arteriosum and reaches the tracheo-esophageal groove. It also contributes to the cardiac plexus, the trachea, and the esophagus. So we have the left recurrent laryngeal nerve. And it also provides for the cardiac plexus, the trachea, and the esophagus. There you have it. So this is all for the cranial nerves and their structures passing through the superior thoracic aperture. Okay, so now we're talking about the nervous structures from the spinal nerves. And first we're going to be talking about the cervical plexus. So from the cervical plexus, we receive the phrenic nerve. So this structure over here, this is the cervical contribution, giving the phrenic nerve. The phrenic nerve primarily comes from the ventral rami of C4, and there are some contributions from C3 and C5 through the nerve to subclavius. It lies on the belly of the anterior scalene muscle. So this muscle over here. This is the anterior scalene muscle. And it curves laterally around the origin of the thyrocervical trunk, right over here. And this is over the second part of the subclavian. So this is the internal thoracic artery, and this marks the point where the second part of the subclavian begins. So this is the thyrocervical trunk. So what were we saying? We were saying that the phrenic nerve, it curves around the origin of the thyrocervical trunk over the second part of the subclavian artery, and it proceeds into the thorax through the superior thoracic aperture, lateral to the internal thoracic artery, right here. And this is the opening. Okay, so fairly straightforward. Now, the motor supply, it gives its supply to half of the diaphragm. So like phrenic nerve on the right side would be providing nerve supply to the right half of the diaphragm, whereas the phrenic nerve on the left side would be providing nerve supply to the left half of the diaphragm. The sensory supply, it gives sensory supply to the mediastinal pleura, the peritoneum, and the fibrous pericardium. And the last structure from the spinal nerves is the ventral ramus of C8 and T1 from the brachial plexus joined to form the lower trunk of the brachial plexus. So we can see that right over here. This is the lower trunk of the brachial plexus. And this is the same thing on the left side. So both T1 and the lower trunk lie on the first rib and exit between the scalenus anterior and the medius muscle. So this is the scalenus anterior, and this is the scalenus medius. So as you can see, the nerves are exiting right between the two muscles. This is the lower trunk.